following is from a cooperative project for acquiring skills essential to learning.
Dispatch Medic 1, you're needed for an unknown medical, South Central College, 1920 Lee Boulevard, North Mankato, room E118. On an unknown.
Copy, dispatch. Unknown medical, 1920 Lee Boulevard, room 128. Hey, we're up. Medic 1, dispatch.
My leg!
There.
Oh, my leg!
It's over there. Please.
Alright, my leg!
BSI,
Oh, my leg, I tell you! My leg, it
what you
hurts!
can see. seen a safe.
My leg!
A number of patients. What do you see? I see one patient. One patient. Next
Please
injury.
help me!
What happened? Don't know. Don't know. Okay, negative injury, nature of illness. One patient, C-spine. I'm gonna have a firefighter. Go hold C-spine, please. My patient's
What are you doing?
level of consciousness
Hold
is
him
alert
here.
because he's yelling. Nature of illness. Obviously, it looks like I have a deformity in his leg. Sir, hello. My name's Jeff with the ambulance. What happened?
Please help me, my leg!
Okay, airways open, patent. He's talking to me right now. Breathing. Do I hear any audible sounds? Breathing. Breathing. Okay. Sir, you have a difficulty breathing?
No, not really. Just my leg's killing me.
Respiratory rate and quality.
Yes, good rate and quality.
Okay. All right. Circulation, pulse, rate.
What do you find?
Got a pulse at 86.
Your heart rate is 110.
110. Okay. Skin, color, temperature, and turgor.
What do you find?
I've got normal, warm, dry, good turgor.
Warm pale with bad turgor. Poor
Warm,
turgor.
pale with bad turgor. Okay. I'm gonna get a set of vitals, Brian. If you could get me a blood pressure cuff and a stethoscope, and I got a pulse rate of 110.
Yep.
My skin vitals. You said pale, warm, and dry. Okay. Also, if we could get a blood sugar too as well, Brian.
Okay.
Take a set of vitals here. Alright, so we're gonna get a blood pressure here. What happened?
I don't really remember all of it, but I think I was standing on that chair
Okay.
working on something.
Yeah, what were you working on?
I think I was changing a light bulb.
Okay, do you know what today is?
Monday,
Monday, okay. You know what month it is?
March,
Do you know where you're at?
school,
You know what year it is?
2013.
Who the president is?
The black guy.
Okay. He's alert, oriented.
Alright, can you get a finger from you? Little poke, okay, sir?
Okay.
Got a blood pressure of 137 over 82. What is my blood pressure?
95 over 62.
Okay, so he's hypotensive. Sir, you feel lightheaded? Dizzy?
A little bit. My head hurts.
You nauseous?
No, not really.
Okay. So you were standing on the chair there and you fell, huh? Can I
Yeah,
get...
I think so.
Okay, can I get another firefighter to pull traction on this leg here? I see some bleeding. I'm going to expose it. Looks like I got a femur fracture here. Just that's fine. Okay, so I'm gonna do my head-to-toe assessment. I'm gonna check his head for any decap BTLS, which is deformities, contusions, abrasions, punctures, burns. Do I see anything with his head?
Just put pressure on that, please.
No.
No, okay. Are eyes pearl, pupils equal, reactive to light?
Yep, a little bit sluggish.
A little sluggish, okay.
Blood sugar 77.
Airway's patent, but do I see any blood, teeth, or vomit in his mouth?
Negative.
No. Any bleeding from his ears or nose?
No.
Okay. His neck, do I feel any step-offs?
Nope.
Nope. JVD,
Nothing.
jugular distension?
No.
No. Okay. Stress the clavicles? Any crepitus?
No.
No. Check his chest for any decap ETLS.
Nothing.
Okay. Listen to lung sounds. Sir, you take a deep breath for me. One more. One more. Thank you. One more. I got lung sounds clear, equal and bilateral.
That's what you hear.
Okay. All right. Abdomen, checking for Dr. Germs. All four quadrants. Okay. Anything?
Nothing.
Nothing that doesn't hurt. Okay. All right. Check the stability of his pelvis. Looking for a decap ETLS.
That hurts on my left side.
Yeah. Okay.
On my right side.
Your right side. Yeah. Okay.
Yep.
Yep. Okay. Check his legs for any decap ETLS.
Nothing on the left.
Okay. This side.
Something on the right.
Okay. Let's expose all this and look at his legs. I found that she's holding. She's pulling traction on it. Do I have good CMS?
No.
Not on this side. This side.
Weak.
Okay. Can you wiggle your toes for me, sir? Yeah. Can you feel me touching you here?
Yeah.
You take off his shoes. Okay. Squeeze my fingers. Okay. Wiggle your fingers. Yeah. You feel that?
Yeah.
Okay. Do I see any decap ETLS in his arms?
Nope.
Okay. All right. At this time, I'm going to apply a C-collar. Brian, patient's blood pressure was low, so we'll start an IV. Got a blood pressure, O2 sats. We get the monitor on him. Do you have any medical history?
I got the CHF.
Okay. All right. Are you allergic to anything?
No.
Okay. Do you take any medications?
That water pill and
Lasix, maybe?
yeah, that's
Yeah.
it.
Okay. Anything else?
Aspirin.
Aspirin. Okay. What do you take the aspirin for?
I don't know. The doctor tells me to.
All right. Sounds good. How old are you?
55.
55. What was his blood sugar?
77.
77.
147.
147. Okay. So we're normal with his blood sugar. What'd you have to eat today?
I just got done eating like that Weggies.
Yep.
Pretty good.
Okay. What were you doing on the chair?
I think I was changing the light bulb.
Changing the light bulb? Were you standing on it?
Yeah.
Okay. Did you get lightheaded or what happened?
I don't really remember what happened. I just woke up on the ground with my
Okay.
wife screaming.
You have any chest pain at all?
No.
No. Okay. I'm gonna consider air just because of the mechanism of injury from the fall. We could get them started, but right now he's going to be a priority patient. We're going to get the backboard over here. I'd like to start an IV if I could get the IV stuff, and then as well as we can get the backboard over here. Let's get the IV stuff out. Okay. So also, you guys are all doing something. The traction splint. Do I have any bystanders? He's hemodynamically unstable. He fell from a significant distance. We're going to put on a traction splint, and then we're going to backboard the patient. So if you could, I'll hold this and you can take off his shoe. Brian,
10
if you
minutes
could
on
get
scene.
that ready. Okay. How much do you weigh, sir?
170.
170? Yeah. Okay. So weighs 170, so we'll put 17 pounds of traction on this, 10% of patient's body weight. All right, sir, this is gonna go in your groin area here, and it's gonna feel a little uncomfortable, but hopefully it'll make your leg feel better, okay?
Alright.
Hold that traction there.
Whoops.
How are you feeling?
Good.
You in pain?
Lots.
Yeah, could you rate that pain? 10 being the worst pain you've ever been in, 0 being no pain at all.
Give it an 8.
An 8, okay. Said you, what are you allergic to?
That hurts.
Yeah?
Nothing.
Okay, alright. So, can we pull?
Yep, you ready?
Alright. What do we have
How's that?
there? That's good. Okay, now we're gonna wrap this. You should put both legs in this one. Do we got any more straps?
Yep, you nailed all those in there? Oh no, there's another one here.
Calling you.
You want some down here?
Alright, sir, so what's going to happen now is we're going to put a backboard, okay? Alright?
Yeah.
We're going to get you to the hospital, okay? You just let me know if anything changes, okay? You can let go of his leg and come over here. Brian, if you
Yes.
want to take his torso here.
Sure.
On Jackie's count, we're going to log roll him as a unit. Brian, if you could just hold him up for a second when you got him on the side. I'm going to check his back
Okay.
for any decap BTLS, okay?
Okay.
On your count.
Ready when you are.
Alright, 1, 2, 3.
Okay, exposed his back, check his back for decap BTLS. Do I see anything?
Negative.
Okay, alright. On you, Jackie.
Alright, 1, 2, 3.
Okay, what we're gonna do now is we're gonna scissor position him. We're gonna come down at an angle, and then we're gonna go back up to get him in the middle of the board. Brooke, if you can just take his legs, I'm gonna take his hips, you
Okay.
take his torso, and on you, Jackie, we're gonna go down, okay?
1, 2, 3.
Okay? And back up on you.
1, 2, 3.
Okay. Doing okay, sir?
Yeah, it just hurts.
Yeah? Your legs?
My leg, yeah.
Okay. How is his CMS after I put that strap on his foot?
It's a little bit better, a little bit stronger pulse.
Okay. Can you feel me touching your foot here, sir?
Yeah.
Alright. I got good pulses on his foot. Okay. Alright. And now we need a head block for his head. Secure his head to the backboard, put the head blocks on. We're gonna lift him up as a unit. Jackie, when you get done holding C-spine, I need you to come here. I'll take the head of the board. Brian, when you get done, take the foot. You two take the sides, and then we'll get him loaded onto the cot. We'll get him into the back of the ambulance and transport. Okay, guys?
Copy.
How you feeling, sir?
Alright, my leg just hurts like
Yep.
a son of a gun.
Okay, we'll get something to help you with that. Okay. All right.
What are you guys gonna do?
We're gonna lift you up. It's gonna feel kind of goofy. We won't drop you, okay?
Mm-hmm.
All right. 1, 2, 3.
Oh, that's funny.
Yeah.
On your footing.
And down. Okay. Let's strap him to the board. Can we elevate his feet and then cover him up with a blanket?
can.
No.
So, not nauseous or anything, are you?
No.
Leg just hurts?
Yes.
Alright, so you guys get the sides. Brian,
Okay.
whenever you're ready, we'll go up.
Alright, up on 3. 1, 2, 3. Down.
Alright, and if you guys could grab that bag and monitor.
Got your shoes, sir.
You. Go to the ambulance.
Okay. You wanna wait? Can you guys help us drop this down to the transport position, please? Whenever you're ready, Brian.
Alright. 1, 2, 3. Down.
Okay. Alright.
Alright. You ready?
Yep.
Okay.
You can go. Alright, sir, so I'm gonna start an IV here, okay? You said you're not allergic to anything?
No.
You doing okay?
Yeah.
You know what's going on?
Kind of.
My patient's mental status.
So, stay the same.
Like, blood pressure's almost done. Brian's doing that. Blood pressure, if it permits, I'm gonna give him morphine, 2
Look at the
milligrams
shirt, alright?
IV.
Alright, buddy?
Alright.
Blood pressure's 118/50,
90/60.
90/60. I'm gonna get a large bore IV established. Tape the line to his arm there. Give a fluid bolus. How much you weigh, sir? 170, was it?
Yep.
Yeah, okay. So we'll give 20 mils per kilogram bolus. That'll be about a 1,500 mil bolus. I establish another large bore. I consider establishing another large bore IV. And whenever Brian's done with the 12 lead, we'll get him out. Get another blood pressure, reestablish vital signs, and treat any other underlying wounds. What's my blood pressure after the bolus?
After your bolus, you're 110/78.
Okay, so I can give morphine just as long as his blood pressure is above 100 systolic. So my dose for morphine is going to be 10 milligrams in 10 mils, and I'm going to give 2 milligrams. So I have 10 mils in here, it's 10 milligrams. So I'm going to give 2 mils IV.
Please your 12 lead, sir.
Thank you. I
You're
got
welcome.
a normal sinus, heart rate is 70. What's his
Sinus tach at 110.
sinus temp? Okay,
Are we ready, Jeff?
we're good to go, thank you.
You're welcome.
Alright, so push
Medic
2
one dispatch.
milligrams. 2 mils in, I'll do 2 milligrams of morphine.
Yes,
Okay,
we are transporting to
Alright,
South
sir,
Central
that'll
Hospital.
hopefully make you feel a little better, okay?
Priority routine.
Alright. The priority.
Priority.
Priority transport, 1457.
Okay, so I gave my morphine, I'll reassess vital signs. After the morphine, has pain got any better, sir?
Yeah, a
Good
lot better.
Number?
5.
5, okay. Do I have any other bleeds or wounds that I see that I can treat?
Minor abrasions, but
Minor
no.
abrasions, okay. We treating for shock, patient's warm, we're transporting. Reassess vital signs. And ready for a video report. Okay. SCC ambulance to SCC hospital, patient trauma report.
Go for trauma report.
We're currently around to a facility with a 55-year-old male who had a simple episode off a chair. Patient was found laying on the floor, open femur fracture. Patient denies any loss of consciousness. Patient's alert, orientated, ×3. Patient was C-collared, backboarded, IV established, 2 milligrams of morphine. Right leg femur fracture was traction splinted. Blood pressure was 95/52, heart rate 110, and patient's skin vitals were warm, pale, skin turgor was poor. Blood sugar was 147. Patient was given a 1500 ml bolus of noble saline. Blood pressure came up to 110/78, 2 milligrams of morphine administered. Pain went from 8 out of 10 to 5 out of 10. So we're currently about 5 minutes out. Priority 1.
Copy 5.